reflective heat, that periosteal.
It's still going though now.
Okay, sorry, we had a little technical difficulty. If we are over the bone here, we will get some reflection of that ultrasound, as we will talk about in lecture. And if we get that reflection of the ultrasound, we're going to heat up the tissue immediately surrounding the bone quite a bit more than we will the other tissue in the area. One of the big problems with that is that periosteum also houses a lot of nerve endings. And so when somebody starts to feel periosteal pain or a periosteal heat, that periosteal pain will start out as a little bit of heat, and then it will be an ache, and then they will scream out in pain because it's not very pleasant. And so yeah, when I'm applying, another thing of note is that I'm placing between 1 and 5 pounds through this sound head. That serves a couple of purposes. The main one is that in order for the air doesn't conduct these waves as well as the transmission gel or your body does. So if we have a gap between the sound head and the skin or the treatment area, it's not going to be nearly as effective as it is if you are flush up against the skin. So applying that pressure will make that subcutaneous tissue surround the head a little bit better, and you get a little bit better transmission. The other thing is, secondarily, by giving it a little pressure, it gives the patient a little bit of a massage, so you get that secondary effect. You notice how I moved my fingers up here. A lot of people on this type of sound head are going to push right here, and your hands and fingers are going to wear out relatively quickly. If you can hold down closer to the head, that allows you to give it a little bit more pressure without wearing out your hand. So that's basically it. Another thing just to be aware of as you are performing an ultrasound is, don't get too caught up talking or giving a lecture to YouTube while you're doing it, because you'll tend to stop. And if I stop right here, she'll start to feel some pain. Do you feel it, Griselda? Not super pleasant, right? If I left it on there longer, you wouldn't like me. You'd like me even less than you do. Let's do it that way. Okay, so that's the application of a 3 megahertz continuous ultrasound for those thermal effects. Let's try something a little bit deeper.
You want me to turn it off now?